So I'm going to do a quick video on what is podiatry or chiropody and what services are provided by us at the clinic. So in this video, we're going to go over what podiatry or chiropody is, what services are provided, a brief overview, and then detailed explanations of possible treatment options for each condition. So what is chiropody or podiatry? It's the treatment of the feet and their ailments. So pretty much what we deal with is any foot problem and can assess and treat a variety of conditions, whether it's something like foot pain or whether it's something on the skin such as a wart. A chiropodist or podiatrist is specialized in the foot. So this is a brief overview of services provided. If you want to pause the video to go through them slower, you can. So fungal nails, diabetic foot assessments, custom orthotics or insoles, heel pain, warts, any type of foot pain, not just heel pain. Plantar fasciitis is really common, corns, callus, ingrown nails, wound care, flat feet, high arches, neuromas, geriatric foot care, so basic routine nail care, bunions or toe deformities, compression stockings, athlete's foot or fungal infections, bacterial infections, arthritis, blisters, and we do some surgeries as well at this clinic. So we do a lot of ingrown nail surgeries, wart needling or wart excisions are available, cortisone injections for plantar fasciitis, neuroma injections. So the first one is fungal nails. So this is when the nails appear discolored or thick, thick. It can be treated with topicals, so we can prescribe topicals for you to put on, but it's very important that you have the nail cut and filed down as much as possible as well to physically take the fungus out of there, or else you're not going to see as much success with the topicals. This is painless. All the nail taken off is already dead, so you don't have to worry about experiencing any pain. There are oral medications available. A lot of doctors don't like prescribing them because they are hard on the liver, so most likely you'll need to do liver tests in addition to the oral medications, but same thing, you still need the nail cut away so the fungus doesn't spread. There is the option to completely remove the fungal nail, which I have done because some people just have been treating it with topicals for years and the nail's growing slowly, so they're not seeing much success. In that case, we just remove the nail. The longer you wait to get it treated, the harder it is to treat and the longer it's going to take to treat. So if you see any nail discoloration, it's better you go in as soon as possible. That way you can treat it sooner and have better success with the treatment. Diabetic foot assessments. So people with diabetes are more likely to have foot complications such as fungus, infections, neuropathy, so they might not be able to feel their feet, vascular insufficiency, so problems with blood flow to the feet, diabetic wounds, and a lot more. So even if you have no complications yet and you're a diabetic, it is good to just get a routine foot checkup, check your pulses, check to make sure you have feeling in your feet, and get some diabetic foot advice as well. Custom orthotics. So what is an orthotic? It's a medical device used to realign abnormal biomechanics or accommodate or offload pressure points of the foot. So what you'll be provided with is a biomechanical assessment and gait analysis, and this is needed to determine whether orthotics are right for you, and if so, then what kind of materials should be used for your foot type, and what modifications might need to be done for your orthotics specifically. Heel pain or foot pain. So this is most commonly due to the way you walk or the shape of your feet. The sooner you seek treatment, the better the prognosis is and the faster the pain will go away. It's important to seek treatment as soon as you start feeling the pain because there are times where people come in after years of having the pain. In that case, it might take a few months for it to go away with treatment. So if you start feeling pain, come in right away to determine the cause and get it treated. Warts. Warts are really common in kids, but adults as well. So they're caused by the HPV virus and they are contagious. There are treatments available that are non-painful and conservative, meaning no need for surgery or injections. But if you have multiple warts all over the foot, then wart needling is a good option because what you do is you numb one of the warts, you poke it 100 times to introduce it into the immune system, and your body will fight off all the warts caused by that virus on the foot or even other body parts as well. Corns and callus. So what that is a buildup of hard skin. Immediate treatment, so treatment that we do the day you come in, is necessary, and it's also painless, so you'll leave feeling better than when you came in. It's also important to determine the cause of the callus and corn, because a lot of times it's due to the pressure points on your foot, and by relieving those pressure points, the callus or corn won't develop as fast. Ingrown nails. So there's many causes of ingrown nails. Conservative treatment can be done, so without numbing the toe or doing anything, we have the special tools and the special nippers to go in there, remove the nail spike, and a lot of times it is painless, and people expect a lot worse. But if you have nails that are really growing inside the skin, nail surgeries are also available to numb the toe and then remove that border and put a chemical there to prevent that side from going back. That way it doesn't bother you again. So it's important to seek treatment before you develop an infection, because in that case, you're going to need to go on antibiotics and we'll have to treat the ingrown at the same time. Flat feet and high arches. So with flat feet and high arches, some people don't have any complications, but a lot of times different conditions arise due to the shape of the foot. So what we do here is a biomechanical assessment and gait analysis to determine whether arch support or something in the arch would be beneficial for your feet, or whether your feet are okay and we don't see any complications developing in the future. Geriatric foot care. So routine nail care is available. Some people have trouble cutting their nails. They can't reach, they have arthritis, their nails are a curved shape and it's hard for them to cut, and we can definitely help with that. Athlete's foot, also known as a fungal infection, is very common with sweaty feet, and this can easily be treated with topical medication. Bunions. So treatment is necessary. So what we do here is conservative treatment to prevent the bunions from worsening. A lot of times it's caused by abnormal biomechanics, and custom orthotics may be necessary to prevent the bunions from getting worse. Bunions can also be corrected surgically, so if we think that may be a good option for you, we would refer you to an orthopedic surgeon for a consult, and they would determine whether or not they wanted to do surgery on you. I always recommend conservative treatment unless it's a painful bunion or really debilitating, because I've seen it where people get the surgery done and then the bunion comes back, or it can be more painful after the surgery than it was before. So it's very important to get a proper consult with an orthopedic surgeon before you go ahead and do that surgery. So wound care and fissures. This can be dangerous because it leads to a portal for infection. So bacteria can go into the wound or the fissure and an infection can develop. It's important to seek treatment to be able to heal the wound or fissure. A lot of times we will need to scrape away dead skin for it to be able to close, and this is painless as well. It's also important to determine the cause and correct the cause of those pressure points to offload those areas. That way you won't develop the wound or the fissure again. And pediatrics. So an assessment is necessary to determine whether children are developing normally or they may not be developing normally. A lot of times parents bring their kids in just for us to look at their feet and do a quick checkup. So a lot of times kids do grow out of certain things such as in-toeing, but if we see it as immediate treatment is needed, then we will refer for that. If we know that it's normal and this is just how kids develop, then we will also tell the parent that as well and reassure them that their child is growing okay, and maybe reassess in 6 months to 1 year to see if anything changes. In-toeing and flat feet are very common conditions in children. Sometimes they need to be managed, sometimes they don't. It just really depends on our assessment. Compression socks. So we measure for compression socks here and order them from a company. They're really good to prevent varicose veins from developing, to reduce swelling in the legs, reduce feelings of heaviness, and prevent blood clots as well. So a lot of pregnant women wear them, or also people traveling because they're sitting on a plane for a long time. So compression socks are a great way to reduce the swelling in the legs, and we measure and order them here. So we do offer other services. This is not a full list. It's just a brief overview of what we most commonly see. If you have any questions, please comment below and we will definitely answer them as soon as possible.